Okay, so today, appreciate your attendance. We'll be reviewing just some COVID updates. A lot of this will be familiar, some of it will be new. Um, if you can hold your questions to the end, hopefully I'll get to a lot of information so you won't need to ask. I'm used to 2 monitors. Right now I have 1. So if there's a delay in responding to questions that you may type in the chat, I apologize for that. But thank you again for everybody for your attention. Go ahead and start here. Y'all can see that the PowerPoint. So these are the 6 topics we'll be the 6 topics we'll be covering today. I do want to preface this by saying that there are a lot of rules and new procedures and protocols and policies around this emergency pandemic. This is not, we don't have the goal of badgering everybody with, COVID bureaucracy. We aren't out to bully anyone with all these new rules. This is a serious pandemic. It impacts, it can have terrible impacts on people's lives. And it is vital that we work together. We physical distance together. We wear masks together in order that we can continue to have this campus open to in-class instruction and fulfill our mission in educating students. I understand it's a royal pain to wear masks. Social distancing is inconvenient. It feels kind of rude and so forth. We'll be talking about that a little bit, but I do want to emphasize that this is very important. It requires a tremendous amount of collective cooperation, and it's all very important to continue on with keeping the campus open. So we'll go ahead and proceed. Assuming I can get this to work. There we go. So the goals and priorities of coming back to campus. Safety. From day one, we've talked about the safety of people, students, employees, visitors. We don't want people to get sick. We don't want this, and we want this virus minimized on campus as much as possible. So again, try your absolute best all the time to do the 4 things that we're being told by all these health experts. Wash your hands frequently for 20 seconds. Keep 6 feet away from other people. Wear your protective face coverings or mask, and stay home when you feel sick. These are vital. Now recognize again that this virus is a new virus. Almost all these protection measures and protocols and procedures that we're being advised to do around the globe are all based primarily on flu. They just don't know enough about this coronavirus, COVID-19, to do anything better. Now, of course, you're reading constantly in the news about developments and things they thought were going to be productive and they're not. They're changing the rules as far as when to quarantine, when not to quarantine, what types of conditions are more susceptible to others. But bottom line is this thing is contagious. It's very contagious, and it can really knock people down. Some of the stories on what they're calling the long haulers about people who have long, serious residual conditions and they're affected by COVID. They just don't get sick and they get better. Some of those are just nasty stories. So this is, again, all important to do these 4 things all the time. Be very diligent about and vigilant about it. Become familiar with the list of safety precautions on the EOU resumption webpage. I think there are over 20 of them. Just go to that webpage. It's down in the corner on the left. If you haven't reviewed that, become familiar with that. it's your obligation to understand what's required and what's expected of employees. Check out the Healthy Monty's 2020 video. This goes over the basics as well, and this is available for and developed for your viewing and the viewing of students or by students. It's on the website. I think that's the biggest mask I've ever seen, face covering, but I like it. The second priority is our mission of student education. We are having this campus open, and we're going to be remaining flexible in our formats, in delivering in-person classes, hybrid classes, remote learning classes. We're going to do it right. We're going to give it absolute our best shot together as Mounties. It requires everybody's cooperation. Let's start with the more specific items. Self-checks. Every day that you're planning to be on campus, go to My EOU in the Mountie Hub and fill this out. For me, it takes longer to log in than it does to complete the self-health check, but so it doesn't take long. Complete it before you come to campus. You can access it on a smartphone or a browser on your smartphone. Answer all 5 questions and then submit. If you answer all no, then you get to come to campus. If you answer 1 or more yes, do not come to campus and contact your supervisor. Let's take a look at what it looks like if you haven't done it already. This is what it looks like when you press this button, the daily self-health check. We'll go over the specific sections. First, you identify where you are assigned to on the day you're doing this. Are you on site here on campus? Are you doing some kind of hybrid combo on campus, off campus? Are you scheduled to come to campus, but are you at home sick? And then the last one is just not coming to campus for all other reasons. Let's ask a few common questions. Complete this again if you plan to work on campus at any time during the day or night. Some people start later in the day, or of course they're night shift people. Just do it before you come to campus. Some of you work the swing shift or the graveyard. You're going to get a notice that you hadn't filled it out yet for today, but just be sure you do it when you come to campus. If you're scheduled to work remotely all day, or you're on vacation or other time off except for being sick, or you're on leave of absence for some reason, completing the self-check for that day is optional. You can do it, but it's not going to be required. Self-screening for symptoms is the second section. If you have any of these primary COVID symptoms, then answer yes. Now, it's important to start to distinguish here. Just because you have one of these symptoms doesn't mean you have COVID, of course. The first one is it needs to be unrelated to a known pre-existing medical condition. For example, if you normally have seasonal allergies and get to sneezing and have upper respiratory congestion, then don't answer yes to congestion or runny nose. Okay, so we're not asking for your symptoms outright, we're asking for new developments. At the same time, if you don't have some underlying condition, but are sneezing and have congestion, don't just say, hey, it's a cold, doesn't matter. No, congestion and runny nose is a primary, has been designated as a primary symptom of COVID, and you need to answer yes. When you do, either your supervisor or the HR department is going to contact you for more information to determine just how bad this situation is, or do you have other symptoms, and so forth, and make a determination whether you can come onto campus. The third section is your body temperature above 100 degrees Fahrenheit. Do you have a fever? Yes. Fever, of course, is a main primary a symptom of COVID-19. Obviously, the next section about testing. Have you tested positive? Please answer yes if you have. Now, again, don't answer yes every day. Just answer yes once, because that'll kick in the quarantine, and you would have already been told by the county to quarantine by this time. Or have you been in close contact with anyone who's tested positive or has been instructed to quarantine? So we'll talk about close contact now and again in a few moments. Close contact means being within 6 feet for 15 minutes or more of a person who has or is firmly suspected of having COVID-19 illness. The last one is you just attest that the information is true, and then you press the submit button. Okay, a few more Q&As. Why does everyone have to do these self-checks? Well, first of all, they're required by the governor versus via guidance from the OHA and the Higher Education Coordinating Commission. Fundamentally, self-checks help employees avoid bringing illnesses to campus. That's the reason for them. Who keeps track of these, of employees on vacation and on leave because they don't have to complete a self-check? The supervisor does this. If you know as a supervisor that one of your employees is on vacation and that popped up on the daily report, then just ignore that. What about employees coming to campus in the evening? We talked about this a moment ago, but I want to review it again. When you receive a notice that you haven't done it because done the self-check because you start work late, fine. Don't freak out. Just do the check before you come to campus. Your supervisor knows what's going on. So obviously, this information goes to your supervisor whether you're completing this and the results as well. Couple more. What happens if employees do not complete their self-check? The supervisor must follow up and remind employees to complete self-checks before coming to campus. Chronic or intentional self-check non-compliance will be treated like any other infraction and subject to disciplinary enforcement. Is this overkill? No. Are we trying to bully people around? No. These are important measures to take. This is a serious pandemic, and this illness can be serious and have huge impacts, lifetime impacts on people you work with. Lastly, are self-checks considered to be medical records that are confidential and protected by HIPAA or ADA? The answers to the medical condition questions are not, because when you answer it, nobody still knows what condition you have. You just happen to have something on this list. I mean, a congestion and runny nose is not a medical condition that qualifies as an ADA or HIPAA protection. However, disclosing a positive test is considered a medical record. But during this pandemic, employers are obligated to protect their employees from exposure to serious illness, and they are given authority to require disclosing positive tests. This is important you understand and share honestly what your condition is. Second big area, face coverings and face masks. You're going to have a lot of questions here. Let's go over them. Face coverings protect others from the micro droplets that you emit when you breathe, talk, sing, sneeze, blow your nose, whatever. They're coming out of your nose and they're coming out of your mouth. And a face mask traps them. Not all of them, but a lot of them. And so it's important to wear this, not for your own benefit. You see across the nation and across the globe, oh, I don't care if I get it, I'm not wearing a face mask. That's not what a face mask is for. Yes, it will block some of the stuff coming in, but unless you wear a form-fitted mask, which we'll review in a second, those particles are coming at you and they're going to come in around the mask. The mask is to protect other people. It shows you're considerate of who they are, okay? Know what kinds of masks and face coverings are okay and not okay. Okay are examples of 3-layer paper face coverings. You see these all over campus. They're available. 2 or more layer cloth face coverings. My mom-in-law made 5 of those for me. I wear them all the time. They're great. Or better quality. Not okay. Face shields and poor quality cloth coverings. Loose weave, gaiters, bandanas. These do not help protect other people from microdroplets that you emit. Again, you see a lot of objection. Oh, I want to wear a face mask because I don't like, or I want to wear a face shield because I don't like face coverings. Well, I'm sorry, but a face shield doesn't do squat for blocking your microdrops from going on to other people. There are alternatives for people who have medical conditions where they can't wear a face coverings for one reason or another, and you need to put in an accommodation request for that, and we'll cover that later in this training. B and C, know how to safely put them on and take them off. For example, wash your hands, and know how to clean them, the cloth ones, or when to throw them away, the disposable ones. The face coverings policy is a temporary policy in force right now, 6.31.05. Check it out under the policy page on the EOU website. It's very important not only that you have face coverings and a good quality face coverings, but that you wear it. It does no good, of course, if you don't wear it. And where do you get to wear it? Common areas all over campus. Hallways, doorways, stairwells, lobbies, restrooms. Put it on when you're walking around in any common area and indoors anywhere. Wear them in-person classroom and lecture hall settings, shared lab spaces, the bookstore, library, crowded sidewalks, crowded areas anywhere, indoor or outdoor. And if you're driving around, not much travel is happening these days, but if you're driving around in a vehicle and you're anybody else in the car, you got to wear it while you're in the car. Some exceptions are permitted. Check out the policy, as I mentioned a moment ago. If you have questions or concerns, contact your supervisor. Now, let's talk about face covering compliance. I did a little bit of research, and in the West here, these surveys are always great. The self-reported face mask use is 67%. But other people perceived face mask use by neighbors is 52. This is like driving. I'm a good driver, but everybody else is a cruddy driver. These patterns bear out. So 67 and 52, overall that's about the middle of the road on the nationally. But here at EOU, we're aiming for 100% compliance, okay? That means everybody wears it and everybody sees you wearing it. Your personal attitude about wearing face coverings are important. Check that your attitude is yes to wearing your face covering. There's a brand new study out this morning. Face coverings work to prevent the spread, to help prevent the spread. Let's talk about how you wear these properly. This is a classic, especially in certain areas where people go, oh yeah, I got a face mask on, but they look like one of the people, 2 people on the left here. They got it below their nose or under their chin, and they're trying to be cute about it. Nope, not allowed here on campus. You got to wear it right. So we have different models here of wearing it right. We don't want to see face coverings below the nose. If you go and get tested, where do they shove the swab up? They shove it up your nose, and that's where the virus is for the most part. So wearing the mask or covering below your nose completely makes those face masks ineffective. Although the CDC says it's not necessary, employees who want extra protection or are allowed to buy and wear their own N95 face masks. These face masks protect them and others when they're form fitted. So the N95, as you know, different face masks and coverings filter at different rates, and the different rates reflect the different size of the micro droplets or the particles. N95 are rated for aerosol, which is 0.3 microns and below. Now, some coronaviruses get at 0.1, but even the N95 is pretty darn good at 0.1 at filtering. So you're allowed to wear these around. I think they're great. I like N95 masks. I have a beard, so it's not going to be form fitted. But if you don't have a beard or a mustache that gets in the way, you're invited and you're welcome to wear the N95 mask. It is really effective at protecting you and other people. You wear an N95 mask that's fitted with a pair of goggles, you're in great shape. You are really protected against getting the coronavirus. When you get one, there are different styles of N95 masks. Don't get one with one of these exhalation valves because that is like a funnel for droplets to be exited from the mask, and you're just going to infect everybody else around you. So those are not permitted. But the regular ones here on the right without that valve are great. Let's move to the next section. Physical distancing. It's simple. Keep away from other people 6 feet. Now, this is great for a lot of people. I didn't want to get near other people to begin with, but it's hard when you got friends that you haven't seen in a while, or you just are very more comfortable being close to people when you talk to them. No, not on campus, not anywhere. In fact, this is a good spot to remind people that what you do off campus makes a huge difference on what happens on campus. So just social distance, physical distance from other people. 6 feet away is respectful. It protects you from microdroplet virus particles from other people. Social distancing or physical distancing, they're synonymous. This is where you protect yourself. It's respectful, it's required. Part of this is complying with the posted room occupancy limits. There are signs all over campus on the rooms, how many are allowed or attached to the rooms, how many people are allowed in each one at the same time. There are a few activities that are authorized to be within 6 feet. Some facilities and planning tasks just can't be done with one person or two people 6 feet apart. Some of the work in the labs or some of the hands-on instruction are authorized to be within 6 feet. In these circumstances, face coverings must be worn, and proximity should be limited to the least amount of time with a maximum of 5 minutes or less. Okay. Again, personal attitudes about physical distancing are important. Check that your attitude is, yes, we have to do this together. We stay away from each other together. How's that? That's kind of goofy sounding, but this is what's going to be happening. This is what needs to happen. Let's talk about reporting safety concerns. I can guarantee you, being in HR, we get a lot of questions about, hey, I'm concerned about this. I don't know about my safety in this circumstances. Hey, I was over in this area and nobody was doing physical distancing. What do I do? First, contact your supervisor. Or if that's uncomfortable or you just don't want to, you're welcome to submit an online form. There are 2 places to get this. One is at the EOU Safety and Security webpage. You'll see it in the lower right-hand corner there, Safety Concern Submission Form. Okay, you press that and you complete it. We'll take a look at it in a minute. The other place is right on the resumption page. It's right there, pretty close to the beginning, but it's on the left. You'll see COVID safety concerns. Both these direct you to this particular form. So you fill it out, put your name there if you want feedback I guess you have to, it's required. If it's COVID related, indicate that, and then don't forget to press submit. When it's COVID related, it goes directly to me, and it goes to Luke Aldridge, who's our new COVID response officer. So you'll get direct attention right away. I shouldn't say me, it goes to the HR department. Let's keep going. This is a real important one. We've been communicating this since July, actually since before then, but more explicitly since July. It's extraordinarily important that you report when you're ill or when you think you may have been exposed. Obviously, containing this, the contagion coronavirus to the least amount of exposures is what everybody has been trying to do around the world ever since this thing busted loose in February or January or December or whatever the origin time is. So I'll go over what happens here, what's required and what happens. So these are the circumstances that you are required to report to your supervisor. If you've been informed by a government authority that you need to be tested, if you have been tested and are waiting for results, if you've been tested and tested positive, or if you've been instructed to self-quarantine by a government authority. Those are the first 4 ones. Now, you remember last spring when there was an outbreak here in Union County, there were quite a few of these circumstances of people getting tested and being or being told to quarantine. If you were told back then, if you are told something similar to that, you need to contact your supervisor, and we'll go over what happens when you report in a moment. Also, employees with 1 or more of the COVID symptoms. If you have any of these, and again, some things in this whole coronavirus and a pandemic are going to be changing. This list has been changed 3 times by the CDC. There didn't used to be a headache and congestion on this list. There didn't used to be a new loss of taste or smell. At the end of July, they updated this list or changed it, and they added some more and took a couple off. But if you have any of these primary symptoms, you need to contact your supervisor. And of course, on the self-check, you would say, yes, I have one of these symptoms. Also required to report to their supervisors or employees who are or suspected that may have been a primary contact. What does that mean? These are employees who are asymptomatic, meaning they aren't sick and have not been tested, but actually have had or suspect they have had close contact with another person who is confirmed to have or is suspected of having COVID-19. Basically, this means you think you may have gotten the COVID from somebody else because you were at a party or you were in a store, somebody hacked on you or something. I don't know. There are lots of different scenarios. What is close contact? Direct hugging or kissing. It would also be directly coughed on or sneezed or something like that by a person who's got the COVID. Or you are within 6 feet for 15 minutes or longer, with or without a face covering. Again, the face covering protects other people, not you. It's physical distancing that protects you. 15 minutes or longer of a person confirmed or firmly suspected to have COVID-19 symptoms or COVID-19 illness. All right, this is really important. Or if you think you've been a secondary contact. These are people who have been in close contact with a primary contact. Now, what happens? Let's see what this looks like, on paper. First, you have COVID-19 floating around. You have an ill employee. If you get close contact or direct contact with that person, or a student, could be somebody out in the public, you become a primary contact. And then if you get close contact with the primary contact, you become a secondary contact. Okay. What happens then? Once you report it to your supervisor, Again, any of these symptoms or an exposure incident, what happens? Your supervisor completes an incident report, and I'll show you what that looks like in a moment. This goes to the HR department, and we'll contact you, we'll ask you a bunch of questions, and we have to make a decision whether you have to go into quarantine or not. And you're going to be asked a whole bunch of questions about who you were exposed to and who may have been exposed to you after you had the exposure to begin with. So that's called contact tracing. Now, we're going to confine our tracing to employees, or student affairs is going to do it with students, but this is what happens. So if you're ill, you're going to go into quarantine 10 days or more. And I say more because if your illness hasn't resolved, hasn't gotten better, then you're going to be quarantining more, but it's usually 10 days. And you're going to be urged to get tested. The county is interested in testing people who have couple of primary symptoms. If you're a primary contact, you may have to quarantine depending on what the exposure consisted of, who it was with, how long did it last, what were the conditions, was it indoors, was it outdoors, what is the other symptoms of the person, did they have any? There are lots of questions we're going to be asking you to determine whether you need to quarantine or not. And if not, you'll go into secondary contact status where you just self-monitor for 14 days. Now, the self-monitor is identical to the self-check, so that's no big deal. Here's what the incident report looks like. They're going to ask you who you are. Do you have symptoms? Have you been tested? Then they're going to ask you who in the heck you were exposed by. Who are these other people you may have bumped into or been exposed, that you were exposed to. So these are the people that you think had illness or did have an illness or did test positive that you were close to. So we're going to identify these people. It doesn't matter whether it happened on campus or off campus. And then we're going to be asking you who may have come in contact with you after you were exposed or after you became ill. So this is important for the welfare of other people, of course, and the welfare of the entire EOU community and the county and the country and everybody else. We're trying to squash this pandemic. This all brings forth the reality of a lot of people's conditions. Not everybody is 18 to 22 and completely healthy. Yours truly included. So there's special accommodation that often need to happen. And these come in 4 flavors. First, this emergency pandemic introduces the heightened possibility that employees with certain medical conditions make them at risk for serious illness if they are exposed to a known coronavirus environment. The conditions that are at risk are defined by the CDC. They can have and change that list more than once. Okay, so honestly, I can't remember if I don't think I'm going to review those, but just go online. It's all over the place on CDC and other places. The second category, employees with certain medical conditions ongoing, covered under the Americans with Disabilities Act, the ADA. They might have difficulty using the necessary precautions that protect them from coronavirus exposures. In other words, they may have a difficult time wearing the face coverings. That's the most common here on campus by far. That's the second category. The third one is employees who have household members with certain medical conditions that make them at risk for serious illness. This is important. We're not interested in having anybody at your house get sick. No, that doesn't do anybody any good. And it really, you don't want to put your loved ones at any more risk than they would have in the general community. So this is important. And D, the other area is anybody else with other needs and accommodation requests. So let's go over these, what happens. So for the first two, employees with an at-risk medical condition who have one, or an ADA disability wanting an accommodation, beyond what is already available in their CJHA. Now, what is that? The CJHA, I'm hoping all of you have had the opportunity to review the CJHA, which is a COVID job hazard analysis or assessment that your supervisor filled out. And you're asked to review that. It assigns your position a low, medium, or high risk to exposure of the coronavirus, and it determines what protection levels you need in order to protect yourself. And then also on it are a whole list of additional items that you may voluntarily elect to opt for that don't get in the way of your job. For instance, if you can do your job remotely, well, that's an accommodation already available to you, and you don't have to put in a special accommodation request. But if you're teaching on campus or you work on campus and it isn't working out for you for some reason, then put in an accommodation request and we'll figure out what we can do. So you just go on Mountie Hub, it's right there. This is what it looks like. Or if you don't want to do that, you can contact the HR department directly. I'm going to be asking you the same questions that's on the accommodation request, but you're welcome to contact me directly. The third category is employees with a member of their household with an at-risk medical condition. Here you want to go to your supervisor or your dean first, because your options are going to be defined by that CJHA. And your supervisor would have already completed this. If not, ask them to complete one. It's automatically sent to you. You review it. If you don't bring up any questions or want it changed, then it stands as is. If you still can't find a solution, contact the HR department. We'll try to figure out something. If nothing can be done, there are certain special leave options you have during the pandemic, and we'll be happy to review those with you as well. The fourth category is employees with other special needs and accommodation requests. This could include childcare needs, but if that's the case, I'm gonna back you up and ask you to contact your supervisor first if you have childcare needs at home, and then come to the HR. But if you have something else that isn't defined here, then contact your supervisor, and if they still have no solution, then we involve Luke Aldridge, who is the new pandemic response officer. He has the authority to make exceptions and find solutions that are out of usual normal range. All right, I'm going to go off sharing screen here and entertain questions. Let's see. Can I define campus? Head Start centers considered campus. Yes, they have their Head Start has their own rules as well. Get together with Robert or Kyle or Deb over there. If they can't figure something out, let me know. But I've been working with them as well. They also have guidelines from the state and the federal Head Start world to follow. But again, it would include Head Start employees. And that would be all the sites, not just the LeGrand site. Yes, this is being recorded and will be, this training is recorded and will be on Safe Colleges for viewing afterwards. Chris, did I hear you correctly? We're to log on at home before coming to work. Correct. I fill mine out right when the alarm goes off so I don't forget. The governor requires it be done before you come to campus. If you get to campus and you have to answer yes, you've already messed up as far as what the self-check is for. Yes, the 6 foot distance required with a mask on or face covering, yes. Social distancing is required all the time except when it's specifically authorized, as in a lab or certain hands-on instructions. Now, I want to mention athletics. Athletics is they have different worlds. The NAIA has all these rules. They have different testing rules. They have different symptom rules. And so these are excluded for the coaches and the trainers. Contact Angie and the other people over in athletics, who Mary and Kaki and so forth. They know what's going on, and they have a different standards as far as what the protocols are over there. But social distancing is universal. You should be social distancing all the time. Stores, gas stations, campus, restrooms. You walk in and somebody else there, got to wait in the hallway. Somebody in the hallway, back off. Okay, so just social distance. Social distancing is good. It's respectful. It's the most considerate and compassionate thing you can do for yourself and other people. Let's see. The protocol for severely hearing impaired individuals. We have alternative face coverings for those. That's probably the first thing I'm going to direct you to. There's this cool thing called this Humanity Shield. Yes, it's a face shield, but it's also got this total filter that wraps around your neck, but you can see your whole face. So that's an option in some ADA situations, or some situations where people can't wear a usual face covering. Is it possible for everyone to receive the reminder email before 8? Alex or Jeff, if you're assuming you're on, can you make a note of that? Maybe we can put it out at 5:30 a.m. For those who like to get up early. Again, I just have an easy thing to do is just put a reminder on your Google Calendar. Not an event, just a reminder. Goes off every day at the same time. Makes it easy. Can you go back to Lisa's question? Custodians that don't have a smartphone, internet, or computers at home. I don't have an answer for that one yet. Yeah, I don't have that. The rules are not our rules. The state rules, and therefore our rules. You have to do it before you get to campus. I don't have an answer for that one yet. Yes, I understand that hearing impaired people can't read lips. If there are specific circumstances that creates a problem for doing your job, then bring it up with your supervisor or bring it to HR and we'll figure something out. I recognize that. What's the protocol for people entering your workspace? First of all, they're not to enter your workspace on a regular basis for any length of time whatsoever. As we mentioned, social distancing is to be maintained. If that has to be broken, they must wear a face covering. It's not, oh, I'm only in here for 10 seconds and out again. Nope. Wear a face covering. Oh, I'm only here to just to go by your desk. Nope. Wear a face covering. That's the rules. Again, we're very serious about this. This is a nasty coronavirus. We want success here for the sake of our work, why we're here, and we want success in educating our students on campus. Beth, great question. Not working on campus, we do not have to complete the daily form. That's correct. If you do receive an email that says to complete it and you're not going to be on campus, ignore it. No problem. Your supervisor is going to know that you're on campus or not. Don't worry about it. Oh yeah, Robert Kling put in at Head Start, put in the link to that rapid response PPE. Robert, if you could talk, is that the shield we were talking about or something else?
Yes, sir. That is the shield that we were talking about.
All right, great. I thank Head Start for finding that one. Are masks required outside? when social distancing is 6 feet or more? Generally not. I say generally because if you're in a crowd where 6 feet might be 6 feet for just a second, if it's crowded or there are a lot of people around, put on your face covering. Otherwise, no, it's not required. More and more evidence is coming forth that coronavirus is passed on via aerosol, these aerosol droplets, and outside has a wonderful ability to disperse these things really well. So that it's not required. Face coverings are not required outside. I encourage them, but they're not required when you have social distancing. Now, again, if you're walking, in between classes through the courtyard, there are going to be a lot of people. Put on your face mask. Put on your face covering. Beth, if we completed the assessment form, then we have to complete the accommodation form as well. Beth, I'm confused.
So my question is, we did the assessment, met with our supervisor.
Oh, okay.
And we indicated that we're high risk and we want to work from home. And we've done all the spreadsheets with everybody in the world. Now I see that accommodation form. Is that another form that we have to complete if we're going to be working from home?
If your assessment form already allows you to work at home, then you don't need an accommodation.
Okay, gotcha. Thank you.
Yeah, good question. I'm going back up top here. Did I miss any questions? Looks like I got them all. All right. After the buildings are locked at night and no one is in the building, does custodian have to wear a mask? Yes, because it's the nature of their work rather than for reasons of working alone. So the custodian should be wearing face coverings during this pandemic when they're doing their work, yes.
That applies to everybody. Whether you come in on a weekend or not, you should have a mask on when you walk in the building.
Yeah. Good point. I don't see any more questions. If you have more, you are more than welcome to email them or submit them on the form that I showed you. If you have questions about what risk level your job is, get together with your supervisor. And if you aren't sure, feel free to contact me. I'm happy to help with that. Barb, I'll get to your question in a second. Again, I do want to emphasize this is a collective effort. If we don't all work together and are very diligent about these measures, it's not going to cut it. Back to questions. Barb, if your assessment says it's okay to work remotely and approved, I don't need to do the daily check. Right, if you're working remotely all the time, you don't have to do the daily check. The daily check is before you come to campus. Good. Does the Humanity Shield require an accommodation? Yes, I want to know if you're wearing that or not. So it is an exception to the face covering policy, and it does require an accommodation, yes. All right. Any last words or comments?
Chris, do you want to quickly show the supervisors how they can update their employees? Or would you like me to share my screen to do that?
Yeah, if you could do that, that'd be great.
Okay, 1 second.
What do you mean by update, Jeff? Update what?
We've given
Better
this.
looking or nice looking shoes? Or?
So supervisors have the option of setting their employees and their status. If they're working remotely, they won't get the reminder to do it. If they're working hybrid or on-site or on campus, they'll get the daily reminders. But this is just me and my staff, and I've set based on their current statuses, and you can update
Jeff,
it.
I don't get this for our employees, for my three that I supervise.
You will. It's a brand new update. It just showed up probably about an hour ago. So,
oh, okay. Well, I'm just saying that Matt and Ed have been getting them, but I'm not getting anything.
yeah.
Yeah, I do want to note the excellent work by IT department, Jeff, Alex, others. superior response and high quality work. Thank you, and make all this work for us. Now, there is one caveat when you use that tool that Jeff just showed you. If you indicate somebody works remotely, they are not to come on campus. Let me repeat that. They are not to come on campus unless they complete the self-check. But if you indicate they're going to be working remotely, they're not going to be getting the self-check. So instruct them that they cannot come on campus without your permission, and then you unremote them and they have to do a self-check. Okay, that's the 1 weak point of making it convenient for everybody.
So then we should indicate if they think they're going to come out, just put them as hybrid, right?
Correct.
Okay.
Perfect. Good. All right. Thank you, everyone. If you have suggestions for how to improve this training, please let me know. I'm happy to listen. And let's see, there's another question. I understand the small pick about particles without the mask. Is there a pick of wearing a wrap around clear face shield? Again, the face shield is open on the bottom, so it's not going to cut it for a face covering. The Humanity Shield, or that thing that, whatever it's called, the rapid response, maybe that's the company, that Robert shared, has this, essentially this giant filter that wraps around and connects to the face mask, and it's really tight around your head so that nothing can get out. It's actually a really high quality filter. It's reusable. You have to wash them every other day, but a face shield doesn't cut it. Face shields are designed to protect the person from getting splashed with bloodborne pathogens. Okay, that's what face shields are designed for, or cooking or something. If you want to wear a face shield and a face covering, you're welcome to do that. But a face shield alone is not permitted. All right. Thanks again, everybody. Yeah, thank you very much. Again, if you have questions, let me know. Thank you.